there have been times when he said, oh, I want to do this surgery, you know, and I've said, oh, you know, I'm just not really sure unless, you know, are the results really going to be that dramatic of a change to his life? Is it really worth putting him through that? And he said, you know, nah, let's wait. We don't need to do it now. Or I've said, you know, in the context of like, it's the middle of the school year and I don't really want Quinn to miss like a month of school for this procedure. Can we wait? And he's just great about, and you know, his schedules are crazy and OR schedules are awful. And I appreciate all that, but he never has once said, you know, we need to do this and we're going to do it right now. And I don't care if Quinn misses school. And he's just never like that. He really sees our family in context. And once when my daughter was little, she needed ear tubes. And so, of course, because we already had this relationship with ENT, you know, we went and said, you know, he said, oh, well, she needs ear tubes. And I said, oh, what's the waiting list for that? And he said, well, you know, it's like 9 months, but we already have an OR booked to do a bronchoscopy on Quinn, you know, next month. Like, we'll just put her in at the same time. It's, you know, I'm not just treating one kid at a time. I'm treating your whole family. And I was like, this is like a miracle. Now, mind you, having 2 kids in the OR in one day was challenging in its own way, but I mean, that was amazing to save us the time of, well, first of all, that we got the ear tubes much sooner than we would have, but to save us the time of figuring out childcare for one or the other and going back and forth and, you know, saving my husband having to take an extra day off work and all of that. Another great surgeon at Children's, we were in the waiting room after surgery, and I heard one of the other surgeons following up with the family and saying, you know, normally we have, you know, it's sort of typical that we would bring you back in after a couple weeks and do this follow-up appointment just to see if he's okay. So, but, you know, I really trust that you know what your kid, you know, when your kid is feeling all right and if anything is wrong. So, like, I'm not going to make you drive all the way here. I don't know where they were from, but clearly it was a drive. I'm not going to make you drive all the way here and look for parking and pay for parking to come so I can look at him for 5 minutes and tell you that he's okay. I mean, you already know that. And I just thought that's it. That's the secret right there. It's just, it's a win-win for everybody. I mean, he doesn't have to use up clinic time, and they don't have to drive all the way and find parking, and if they have other children, find childcare. And so those are the kinds of things, like just thinking about families in their context, not just thinking, oh, well, you know, this is the way we do things. We do surgery and we do follow up, so we just, you know, we're going to just keep doing it. To actually think of that family in their context was great. I wanted to run over and hug them, but then they would have realized I was eavesdropping, so that. I do a lot of eavesdropping in the hospital.